everybody. My name's Amy Taylor, and I am here with a Miss Crystal Watson today. And we're going to talk to you about what it's like to get tested for COVID. She actually had the test, and she also works in the healthcare industry. She's going to talk a little bit about the changes that have happened within our healthcare. Miss Crystal, hello and welcome.
Happy to be here.
Tell us a little bit about what it is that you do, what you can tell us.
I'm an x-ray technologist at one of the local hospitals, so I work in the hospital and also at the outpatient facilities.
How long have you worked for them, and do you work for different facilities or just one?
I work at 3 different facilities for a local hospital, and I've been there as an actual radiologic technologist for 3.5 years now.
Do you enjoy what you do?
I love it.
What about during these scary times? How does that make you feel about your occupation that you've chosen?
To be honest, in the beginning it was very scary. I guess the fear of the unknown, but as we've progressed through the whole pandemic and the virus, my fears have lessened, and I'm doing everything that I can to protect myself and my family, and I feel like the hospital that I work for is doing the same as well. So at this point I feel good about it. I feel like I'm involved in something that's going to make history at some point, and we're saving people's lives and doing the best that we can.
Have you come face to face with any COVID positive patients? And are you aware if they're COVID-19 positive when you're dealing with them?
So basically, my job, I work in the emergency room, and then I also work as a department technologist filling in time to time. So in the ER, you don't know necessarily that the patients are positive. However, the hospital that I work at, basically, if you come in with certain symptoms, fever, cough, respiratory, they automatically put the patients into, they call them airborne or droplet precautions. So that being said, we take the highest level of precautions necessary to protect ourselves and the patients, until we know for sure if they are positive or they aren't positive. If they are positive, yes, we do know, and yes, I have been in contact with positive patients. And again, it's the same type. We wear gowns. It's called PPE, which is protective or personal protective equipment. If it's droplet airborne, we wear gowns, we wear face shields or goggles, we wear N95 masks, which I brought one with me, which is this green mask. And we also have to glove, and then the cleaning, after we have interacted, is we have certain types of chemicals and wipes that we use to clean the equipment and that kind of thing. So
Do you feel that your hospital is doing all that they can to protect you as an employee, or do you feel that they could be doing more?
I feel like they've been great. They've been on top of all of the updates with the CDC, which I believe that most hospitals in the area have been. I mean, in the beginning, things were literally changing daily as far as our protocols and how we had to react and deal with certain situations. But I have never once felt like my employer has jeopardized the well-being of the employees at all. I feel like they're doing everything they can, given the knowledge and the information they have, to handle the situations and deal with things appropriately.
That's really good to hear, considering that you turn on the news and you hear people who don't feel safe at work, people who feel that they might be more vulnerable than others. You hear someone from the front lines right here actually working as an x-ray tech who does checks, chest x-rays, so on and so forth. She feels that she is completely safe. So that is really good to know that they're taking care of our first line people. And you mentioned the I-95 mask. If you want to hold that up, maybe we can get a quick shot of this, Zachary. of the I-95 mask, and then you're going to talk about what makes this mask so very, very special. It was my understanding as a layperson that these masks were hard to come by and that they were in short supply, and we got more in from China, we got more in from Italy, so on and so forth. Did your hospital have a shortage of them, and what is the situation as far as the supply and demand goes currently?
So, as far as me personally, I haven't had an issue getting an I-95 mask. These masks are specifically fitted to you personally, to make sure there's different sizes. They're not just your standard surgical mask, that kind of thing. They're actually fitted to your face. They come in small, medium, large. They may be even extra small, I'm not sure. As far as my facility goes, no. However, we are only using this mask if the patient is potentially COVID positive or COVID positive, and we're using reusing them for a certain period of time. I have not had an issue getting one or getting new ones, as well as I'm pretty sure most of my coworkers have not experienced an issue either. I do know there is a shortage. Typically you don't reuse them, too much, but we have not had an issue so far. So
What about other hospitals in the Pittsburgh area or in Pennsylvania, Allegheny County specifically?
I'm going to be honest, I can't speak for them. I don't know. I can just speak from my experience and the information that I'm dealing with day to day.
I noticed that this particular mask has a metal nose guard to fit around the nose. What else makes this mask so very special?
So you can kind of tell by looking at the mask itself, it's formed more to your face, your nose. The metal is to conform around your nose and to fit individually, like people, everybody's nose is shaped different, to create a better seal for droplet and airborne type diseases and viruses, which COVID is. The filter also in it is a lot thicker than the typical surgical mask that I have here. And anybody with COVID and, airborne precautions, it's all based on, if you cough, you sneeze, droplets. So the better the filter, the thicker the mask, the more filters, the better protected that you are. And obviously we're wearing these because we're going in and directly interacting with patients at, shorter distances, closer proximity, and puts us at a higher risk. If you're 6 feet away, your typical surgical mask, that type of thing is more than doable. But when you're up and doing a chest x-ray or touching the patient, that kind of thing, protects us better.
And which mask did you say you give to the patients when they come in? Oh, a different mask entirely. Let's talk about this. This looks like a duckbill mask, and you give this to the patients. Is it a one-time use?
Yes.
Do they get to keep it when they're done, or do you dispose of it because of the germs?
Basically, we give this to the patient if they come into the ER and they have symptoms that we feel could put them at risk for having COVID or even the flu. This is a typical flu season mask as well as the COVID. And this protects the patient, but it also protects the employees and the nurses and staff that are interacting with the patient while they're in the hospital. So if they cough, sneeze, and they have this on, it protects.
One more clarification. What would be the difference in the fabric between that, the paper mask that you gave first, and then the I-95? Is that like a middle ground kind of fabric?
Yes, so the I-95 is basically more filtered, thicker, and as I said, as hospital employees, we're fitted for these through the hospital. So you get assigned a mask. It's not even just for COVID; it's for other airborne type diseases like tuberculosis, flu, that kind of thing. So everybody wears a different size, and you want to make sure it has a good seal. So this is what we use to actually directly interact with the patients. This mask here is what we give to the patients who could be potential or what have you. It is thicker. It also has the metal nose piece. It has 2 straps that go around the patient's head And this is what we assign to the patients. It's called a duck bill.
Very, very interesting. I remember back before the shutdowns. So if we shut down on Friday the 13th of March, I want to say we'll just make up a random date, the 6th of March. I had made a purchase from another state. And when that purchase arrived to my house, in the packaging, it was one of those like baggy packaging where you open bags, this was in with it. Someone that I had placed an order with had sent me an I-95 mask as a thank you for my order, and with a little note that said, "Good luck, God bless." And I did not even realize how useful this mask would be, say a week, a month down the line. Their thoughtfulness when they sent this to me really blew me away. I made a purchase from Cafe Press. And when Cafe Press sent me back my order, this was enclosed in a Ziploc baggie with a personalized note. I mean, they didn't have to do this. This is the mask that I wear when I go grocery shopping, when I go out, anywhere around seniors, anywhere I go, this is the mask that I wear. But anything that, like Crystal said, that captures the droplets that come from your nose or your mouth. And I think the important thing to know, mine also has the metal part that conforms around the nose, and it has a little cushion for the inside of the nose. The important part is, and I know I've been to Giant Eagle, I've been to Walmart, and I see so many people wearing their mask like this. A friend of mine from the healthcare profession gave me the analogy that wearing your mask without covering the nose is like wearing a condom if there's a hole poked in it. It's not going to do you any good. The germs will still escape. You're still breathing in through your nose the germs, the viruses, all that. You need to cover the nose. You need to cover the mouth completely and securely. Like you said, it has to conform to your face. Perhaps some of you have seen pictures on the internet or on the television on commercials where they show the ring, and I want to say it's either Oil of Olay or Dove that does a special commercial where this is the new face of beauty, where they have the marks, they have the scars, they have the lines from it digging in deep because they're trying to keep it so conformed to their faces. Covering the nose is very, very important. So it does you no good to cover your mouth if you're breathing through your nose. Because if you're breathing the viruses in and it goes into your lungs, you will get ill. So I'm trying to help people. Knowledge is power. I'm trying to teach you that you need to cover your nose, you need to cover your mouth. The rules state that you need a mask to enter any place of business, effective now. It does you no good if once you enter the building, you take your mask off and put it around your neck, or you pull it down beneath your nose so you can breathe easier. You won't be breathing much easier if you're intubated in the hospital. Please take the necessary precautions. Correct me if I'm wrong with any of the analogies or any of the stories that I'm telling here, that you do need to cover the nose as well.
Absolutely. All the tests and research and that kind of thing has come back that it is an airborne droplet type of virus, which means it is entered through the human body, through the nose, the air passageway, coughing, sneezing, breathing, that kind of thing. So, you cough, you cover your mouth, you touch, a surface, and then somebody else touches that surface, and then they touch their nose, scratch their nose, their mouth, their eyes, that kind of thing. So yes, the mask is meant to cover the nose, the mouth, the complete airway.
Wash your hands, sanitize your hands, take those sanitized like wipies, the wet ones, wipe off your hands before you remove your mask. You do not want to transfer the germs onto your mask as you're taking it off the minute you leave the building. Get the sanitizer out of your pocket, get the wet ones out, get the sanitizing wipes out, wipe down your hands, wash your hands, then pull the mask off.
So everyone is, obviously, if you're in a situation and you don't have hand sanitizer or wipes, that would be the go-to. But ultimately, washing your hands for 20 seconds or more is the best thing that you can do if you are able to do that. Obviously, if you're at the store and you're coming back to your car and you don't have access to soap or water, that kind of thing, then in the interim, use the hand sanitizer and the wipes and that kind of thing until you get home. But definitely, hand washing it's imperative, and it's been found and proven, and it's something we should be doing anyways, but especially in these times.
And like President Trump said, these virus germs are scaredy cats of soap and water, and they're scaredy cats of hand sanitizers. Now, I know that you had mentioned to me a little while back where you can actually make your own hand sanitizer using aloe and using alcohol. Tell us quickly about perhaps that recipe that the people at home could be doing for themselves, because I know that sanitizer is almost impossible to find on the shelves.
So you can basically Google online any of the websites. They have recipes. I don't know the exact, what part to what part it is to make it effective. However, the aloe is for the moisture so your hands don't dry out. The alcohol is what kills the bacteria and that kind of thing. You obviously, if you're using it, periodically and quite frequently, you don't want to just have alcohol. So that's the purpose of the aloe. But like I said, if you just Google homemade hand sanitizer, the two basic ingredients in any of it is aloe and alcohol, rubbing alcohol.
And I believe you yourself are able to make your own Sani wipes, your own sanitizing hand wipes. Do you happen to know what is involved in that?
So I have done that just because they're scarce and it's hard to find. So it is so many parts bleach, so many parts water, and you can use just a paper towel and basically get yourself a Ziploc bag. Again, the recipe, I can't recall the exact parts and amounts, but you take the water and the bleach, you mix it together, the paper towels, you soak it in the solution, and then you can put them into like Ziploc bags and use them as you need them to wipe down, whether it be groceries or what have you. But it's just bleach and water. And again, you can Google that online too to get the exact quantities of each.
Those are great recipes for those of you looking for something to do when you're quarantined in your home. Thank you so much for that information. I understand recently that you suffered a scare with COVID-19. I would like you to talk about what led you up to the scare, your symptoms, and what was done.
So basically, I wasn't super concerned that it was COVID. However, given the current situation that we're in, in society, and that my place of employment, because I am working in a hospital and I am exposed or potentially exposed to COVID positive patients, required, because I had a fever. That was the only real symptom that I had that's COVID specific. Over 100.4, I was required by my place of employment to get tested, which I did. My test did come back negative. However, I did go. I went to a testing site here locally. I didn't get out of my car. I drove up. The nurse, the person that performed the test, came out to my car. I rolled the window down. She verified my identity through my license and things of that nature. And then she swabbed my nose. At the time, this was probably a good month or so ago, month and a half. The swab did last probably, I would say, about 20 to 30 seconds. And it was in one nostril, kind of like a flu swab, but a little bit longer and more in depth. And then I got my results within, I want to say it was 3 to 5 business days. So,
How long was the Q-tip swab? And how long did they swab your nostril for? If you could demonstrate or show us.
so I would say the swab itself was probably about 6 to 8 inches long, and they put it up my nostril. They had, at the time, at least when I got tested, they put it up quite far, and they have to, at the time, left it up there, I would say, for at least 20 seconds. It seemed longer than probably what it really was. It wasn't painful. It was uncomfortable. My eyes watered. I felt like I had to sneeze or cough, that kind of thing. But it it was just discomfort. It wasn't pain or anything like that.
And you said your test came back in 3 to 5 business days. Did they call you, write a letter? How were you notified?
So I was notified through a phone call initially, and then I got formal results via letter in the mail a couple days later. So it did go through the health department and that kind of thing. And then my employer, I had to be fever free for 72 hours before I was permitted. Even though my test was negative, I still had to be fever free for 72 hours before I was allowed to return to work.
The call that they made, was it a robocall or was it an actual person? What did they say if it was a person? And how was their compassion when they made that call?
It was actually a person, and they were very kind. Even whenever I called to schedule my COVID testing through my employer, I had to call a certain hotline to make the appointment and that kind of thing, and they were very kind and caring. And then since then, they've called me multiple times to follow up to see how I'm feeling and, you know, make sure I'm doing okay and ask if I have any questions and that kind of thing. So through the whole entire process, my employer has touched base with me multiple times.
Your employer has touched base with you. Has the Department of Health contacted you again since then, or after the negative letter? No, they haven't contacted you, correct? No. Correct. So just your employer has kept in touch. But you felt that your symptoms were COVID-19 worthy, or your employer felt your symptoms? What brought you to be tested?
Basically just my fever. I didn't feel that I was COVID, but because I was in a situation at work where I potentially could have been exposed to it, they required that I be tested. I didn't think that I had it. However, you know, the symptoms have varied from individual to individual. I mean, they're showing more respiratory symptoms for the most part. Mine was more GI related, but I did have a fever, so I was not allowed to go to work until my fever was gone regardless.
Did you receive a bill from that? Is it covered under insurance? Or is this just part of the government's program that they're just taking care of anything COVID-19 related?
Up to this point, I have received nothing. And to be honest, they didn't even ask for my medical insurance. So I don't know if the government is covering it or my employer is, but I have not been billed or received anything regarding the COVID testing to this point.
So the only thing you had to provide was a driver's license. No prescription necessary, no insurance card, just your driver's license to prove that you were who you said you were.
Well, I was tested through my place of employment, so I showed them my work ID and then my driver's license.
I understand. And your symptoms, you said it was mostly the fever that brought you in there. And the fever lasted approximately 3 to 5 days, I'm guessing, and then it went away, and you've been symptom-free since then. You seem okay to me today. God bless. I'm glad for that. That makes me very happy. Do you know if how many centers were testing at the time when you had it done? Was it like one a block, like a CVS or a Walgreens, a Rite Aid is now? Or did you have to, like, if the average Joe back in when you had it done needed a test, how many places were doing it?
Here locally in Bethel Park area, I only know of 2 locations. I'm not saying there weren't other locations, you know, outside of the area, but 2 that I'm positive and for sure I know were testing at the time. Now, today I don't know what sites are testing and, you know, where you can go at this point.
And I understand that you have people in your family that are of high risk for health concerns. Are you taking extra precautions in your home, at your line of work, in your life or lifestyle to protect those loved ones?
Yeah, I think we're pretty much doing what everybody else is. We're doing the social distancing. I'm the only one that's doing the grocery shopping. And when I bring the groceries in, as crazy as it sounds, I wipe everything down with, you know, disinfectant, bleach, wipes, what have you. I do have a son that has a heart condition, so he is at a higher risk, and that is a very big concern for me. But either one of my children, it's a concern regardless, as a mother. However, when I go to work at the hospital, I wear street clothes in from my home. I change into hospital scrubs. We have sterile hospital scrubs at the facility. I change into those, and then before I leave, I change back into my street clothes, come home, shower, go about my business and that kind of thing. So I feel I'm doing everything that I can given the circumstance. Knock on wood, everyone's healthy and doing well. And that's really all we can do.
You mentioned that you were quarantined for 72 hours after you took the test. How did you quarantine yourself from your children or from your family during that time?
So I was quarantined basically more than 72 hours because I was quarantined from the time I got sick until I got my test results back. And then even before that, I had to be fever free for 72 hours before I was declared, not contagious or what have you, whether I had it or not. So my children, basically, I'm a single mom. They stayed with their father during that time period. And I was at home by myself until I knew I was free and clear and it was safe for them to come home and I was negative. And then my children came back to the house with me.
Very, very cautious. I appreciate that. I know that Bethel Park residents yesterday received a call. I want to say it was from the mayor. And the mayor told us that as of yesterday, May the 1st, there are currently 20 positive COVID cases in Bethel Park. And additionally to that, 3 new cases from just 8 days ago, which means it's still present in our neighborhood. It's literally in our backyard. It is here. Not just in the United States, not just in Pennsylvania, not just in Pittsburgh, not just in Allegheny County. In Bethel Park, there's 20 people that have it. 3 new from just last week. I'm imploring everyone to please take the necessary precautions. Go above and beyond what you need to do. Social distance. Continue to social distance. 6 feet apart. You see, it takes an extra second or two for me to hand off the microphone. We're being extra cautious. Okay? I need you guys to wear masks. And when you wear masks, make sure it covers your nose as well as your mouth. She mentioned, Miss Crystal mentioned that they also make masks in smaller sizes. So please put them over your children's faces as well. The little ones are just as susceptible. This is a disease that knows no barriers. It knows no economic constraints. It defies race. It defies religion, age, everything. It can affect you. It can affect me. I want everybody here in Bethel Park and all over the world to stay safe, healthy, fit, and strong. That's my wish to you. Please do the necessary precautions and continue to do so. I know that I was recently sent by you notice that Dependable Drive-In was supposed to open next week. Well, how exciting. I'm sure a bunch of people would love to get out on a beautiful day, a beautiful evening, and spend it out. Within 24 hours, it was shut down, and the drive-in is no longer open. This is how quickly the news changes. This is how serious it is. Yay, let's all celebrate. Boom. It's not time to celebrate. Do not let your guard down, Bethel Park. Do not let your guard down, because it would be silly and careless of us to do so. Continue to social distance, continue to quarantine, continue to wear your masks. Please, please do so, because I'm hoping that in a month or 2 or 3 or however long it takes, that 20 positive cases in Bethel Park turns out to be 0. The new cases will not have been recorded for weeks. That's what my hope is for Bethel Park. If everybody just does their part, I'm sure that we can, as a community, rise up together and fight this so that we can fight it together.
Just keep doing that. It's working. I mean, the numbers, obviously, the hospitals are not overwhelmed with super sick patients, at least here locally. I think that what we are doing is working, so keep doing what we're doing and stay safe and just know that this is temporary. We'll get through this and we're all in it together, and help your neighbor.